Hello and welcome. My name is Demitra Tsivos and I'll be talking about quality of life in individuals with epilepsy and psychogenic non-epileptic seizures. This research was part of my clinical psychology doctorate program and was conducted with Dr. Iain Campbell and Professor Tom McMillan. I've got a few definitions before we start. Seizures are bursts of electrical activity in the brain that temporarily impact on functioning. And psychogenic non-epileptic seizures, or PNES, resemble epileptic seizures, but do not show abnormalities on EEG. They are believed to stem from distress and emotional dysregulation, and they require mental health treatments rather than epilepsy treatments such as epilepsy medications or resective surgery. Health-related quality of life is an important construct which encompasses more than the absence of physical symptoms. It measures physical and mental well-being, cognition, social ability, education, and employment. A bit of background: quality of life in people with PNES is low compared to people with epilepsy and low compared to the general population. Comorbid physical and mental health problems are common in both groups. And research in the Scottish population reveals that people with 2 or more chronic health problems experience higher rates of deprivation and have poorer quality of life. So addressing quality of life and providing person-centered care is imperative for these populations, especially given the physical, mental health, and social complexities. The aims of the research that I conducted were to assess quality of life, and in particular, indicators of mental health in the populations, begin to assess the impact of inpatient admission within a specialist care centre. The methods used were a retrospective cohort study using routine outcome measures of inpatients attending the SEC. This included 23 individuals with PNES and 55 individuals with epilepsy. The data that was used was admission measures that were collected prior to an inpatient stay that typically lasted between 2 to 6 weeks within the specialist centre, and then looking at discharge measures that were also collected. The results indicated that the PNES group had significantly lower Scottish Index of Multiple Deprivation scores than the epilepsy group. So to give you a bit of context, a Scottish Index of Multiple Deprivation score of 1 is the lowest possible score out of 20. The PNES group had an average score of 2, and the epilepsy group had an average score of 8. So both groups were experiencing significantly high levels of social deprivation. There was no significant difference in the mean quality of life scores between the two groups. And in terms of changes to scores over admission, in the PNES group, quality of life and anxiety scores improved during admission. You can see from this table that the quality of life scores on admission were 33, and these increased to 50 on discharge. The GAD-7 scores reduced from 13 to 9, and both of these were significant changes. In the epilepsy group, all of the measures improved during admission. So quality of life improved from 29 to 49, depression scores dropped from 18 to 15, and anxiety scores dropped from 15 to 8. So it's clear that the deprivation faced by both groups is really high, and it's likely to compound on the physical and mental health problems and experiences and outcomes of these two groups. Quality of life improved from admission to discharge in both groups. It's impossible to say what aspects of inpatient admission impacted on that improvement. So further research could begin to investigate which components of the inpatient stay at the SEC contributed to the improvement, and importantly, whether this improvement persists beyond their admission. It's really important to think about pinpointing the aspects of care that contribute to this improved quality of life, as it would not only benefit future patients going through the centre, but it can help us to think about how to engage and support the wider population of individuals with both PNES and epilepsy who don't get access to these kind of specialist services. That's all I've got for you today. Thanks for listening.